Excellencies, distinguished guests, ladies and gentlemen, it's a great honor to be able to share some thoughts as part of the video consultation with Member States on the Draft Regional Action Plan on Aging 2020. Population aging will be one of the most important drivers of social transformation throughout the world. According to the United Nations Department of Economic and Social Affairs, 1 in 6 people globally will be over the age of 65 by 2050. The Western Pacific region, which is home to about a quarter of the world's population, also includes some of the world's most silver societies, such as Japan. Singapore's population is aging rapidly too, driven by rising life expectancy and persistently low fertility rates. The number of seniors aged 65 years and above is expected to double from 510,000 in 2017 to close to 1 million in 2030. At that time, about 1 in 4 Singaporeans will be 65 years and older in age. Chronological age is a convenient and the most commonly used way of characterizing the changing demographic profile of countries. This is associated with a strong focus on the social, health, and economic challenges for societies, which by and large have been historically organized around younger population demographics. While all these are important considerations, it is nevertheless critical that we do not confine ourselves to thinking of aging in just those terms. A Lancet Public Health study published in 2019 compared the disability-adjusted life years, or DALYs, of age-related diseases across 195 countries between 1990 and 2017. It found that the equivalent age to global average 65-year-olds varied substantially between different countries, ranging from 76.1 years in Japan, about 76 years in Singapore, to 45.6 years in Papua New Guinea. This suggests there are many opportunities to translate greater longevity into longer years of relatively good health with a lower burden of age-related disease. And with that, enhanced prospects for continued learning, active engagement, and contribution to society. This should result in a double plus, both for the individual and for the nation. In order to make progress in this direction, however, we have to recognize that aging is a complex, multidimensional issue. It therefore requires a whole of society effort led and supported by the government. It is also critical to adopt a life course approach which addresses health, social, and environmental determinants right from the beginning of the life course. This is important so as to achieve maximum impact on individuals as they and the society age. Singapore has endeavored to adopt both of these approaches in our journey in population aging. Singapore started to prepare for population aging since the 1980s. While our population was very young then, the direction of the demographic trends was very clear. From the outset, we have endeavored to take a whole-of-government approach, which is holistic and comprehensive. More than 10 government agencies and ministries work together on aging-related issues, including health, social and family development, and national development. Their work covers policies and strategies spanning many domains, such as health and wellness, retirement adequacy, lifelong learning, and employment. At the same time, we work actively with many stakeholders, including non-governmental agencies and unions, and private companies. Public engagement is a critical element, and this is carried out through different platforms, including focus group discussions, public engagement sessions, and online consultations. This is really critical to ensure that our policies and programs remain relevant to the needs of our citizens. In 2015, Singapore launched its Action Plan for Successful Aging. This is a US $2.2 billion national blueprint which covers more than 70 initiatives across 12 areas to enable Singaporeans to age gracefully and confidently. This has brought multiple government agencies and partners from the private and people sectors together to develop, conceptualize, and implement initiatives and recommendations that will not just help older persons but also the broader population in Singapore. I would like to emphasize that even as we are implementing the Action Plan for Successful Aging, this is embedded in a broader population health framework built on a life course approach. We believe this is critical because the health of older persons rests on foundations laid down when they are young, and the cumulative effect of social, health, and environmental determinants. In line with this, we have placed great emphasis on preventative health and health promotion programs across different life stages and settings, from pregnancy and early childhood to schools, workplaces, and the community, to cater to the evolving needs of an individual over that person's life course. For example, Singapore's School Health Services has extensive educational programs and conducts regular vision and dental checkups, as well as health checkups and immunization. For adults, we have Screen for Life, a national screening program that encourages Singaporeans aged 40 and above to go for regular health screenings and follow-up for early detection and timely management of chronic conditions such as high blood cholesterol, hypertension, and diabetes. For seniors, we launched Project Silverscreen, a public-private partnership with business community to provide community-based functional screening for older persons aged 60 and above. With early detection of common age-related decline in vision, hearing, and oral health, appropriate follow-up interventions such as treatments and assisted devices can be provided to enhance the health and quality of life of our seniors. In recent years, our strategy has also shifted to large-scale programs which encourage active participation of citizens across all age groups in health promotion. For example, the Health Promotion Board rolled out a National Steps Challenge, where participants can earn rewards with increased physical activity levels, encouraging all citizens to move more and stay more active. By gamifying the process, we have seen sustained levels of engagement and healthy behaviors over time. For example, 1 in 3 Singaporeans have signed up for the challenge, and of those who have completed all the reward tiers in the first 3 seasons, 60% continued to clock a daily average of more than 7,500 steps after the challenge ended. Keeping healthy is not just about physical health. We also recognize that social, mental, and health needs are closely intertwined, and the lack of social support may lead to health deterioration and vice versa. Because of this, we developed the Community Network for Seniors to provide support for seniors close to where they live. Volunteers proactively reach out to seniors and identify lonely seniors who would benefit from befriending services, as well as frail seniors who need greater social and healthcare support. Community partners encourage seniors to participate in active aging programs. Our Agency for Integrated Care is a central agency that coordinates aged care services for seniors with complex social and health needs and also try to close the last mile in service delivery. Rapid population aging will have a profound and wide-ranging impact on all aspects of society and the economy. An integral part of a whole-of-society effort to age well involves changing perceptions and the public narrative on aging. There is no doubt that population aging will result in many complex challenges. At the same time, there are many important opportunities for aging to bring positive benefits, impact, and meaning for individuals, families, and society. This is the challenge and also the promise for policymakers and public health officials in Singapore and other parts of the world. Early planning, sustained commitment, and taking a long-term view will be critical in this regard, as the benefits will take a long time to materialize. On this note, Singapore supports the WHO Western Pacific Regional Office's efforts to develop a new regional plan for aging in the Western Pacific. We look forward to the ongoing exchange of ideas and sharing of experiences from our other member states. Thank you.